Now trying to free guests from a hotel that's collapsed in the city of Guangzhou. 32 people have been brought to the safety. About 70 people are believed to have been in the hotel at the time of its collapse. The hotel is used for coronavirus quarantine, according to the official People's Daily. No reason for the collapse has been given thus far. Meanwhile, Iran's health ministry says nearly 150 people have now died from the coronavirus. More than 16,000 people are currently being monitored in hospitals. In the Netherlands, the official total of confirmed coronavirus rose by 60 today to 188. There's also been a steep rise in cases in Germany, where almost 700 people have been diagnosed with COVID-19. Italy, the worst affected country in Europe, says it will start recruiting retired doctors as the number of cases rise to more than 4,600. 197 people have died from the virus there. The Italian government this week ordered the closure of school, universities, cinemas and theatres to stem infections. And the Maldives today confirmed 2 cases in the island nation. Since the announcement of the first confirmed case of the virus in KwaZulu-Natal, there's been a sense of public panic, with many people looking for information around testing and treatment. For more on how to reduce the risk of contracting the coronavirus, let's take a look at the following awareness insert.
The World Health Organization advises people to adopt the following measures to prevent contracting coronavirus. Wash your hands frequently and thoroughly with soap and water. Alternatively, use an alcohol-based hand sanitizer to kill germs that may be on your hands. Keep a distance of at least 1 meter between yourself and anyone who is coughing or sneezing. When an infected person coughs or sneezes, they spray small droplets of liquid from their nose or mouth, and if you're too close, you can breathe in the droplets containing the virus. Avoid touching your eyes, nose and mouth. Your hands touch many surfaces and pick up viruses, which you can then transfer to your eyes, nose or mouth, which could enter your body and make you sick. Make sure you and those around you practice good respiratory hygiene. That means cover your mouth and nose with a tissue or your bent elbow when you cough or sneeze. Then dispose of the tissue. Go immediately to your doctor if you have a fever, cough or difficulty breathing. Your doctor will advise on the best course of action. Thoroughly cook your meat and eggs and avoid unprotected contact with live and wild animals. Stay up to date with the latest information concerning the coronavirus to help protect yourself and those around you and to prevent it from spreading.
For the latest, we're joined now by Health Minister Dr. Mkhize. A very good evening to you, Minister. Thank you so much for speaking to us. You spoke to earlier program, but I believe there have been more developments in terms of the number of South Africans. We spoke about South Korea, somebody who's tested positive there. But do we know the actual number of South African nationals that have been declared as infected with COVID-19?
Well, thank you very much. In South Africa, we have only tested 2 people who are positive with the coronavirus. All the other stories that are reported about South Africans that might be having coronavirus are not true. Only 2 people are confirmed. And we have at the National Health Laboratory Service and NICD have the capacity to prove and to confirm, test and confirm. And so even the private sector uses the same laboratories for confirmation. So we can trust that the information that comes from there is reliable. Outside South Africa, there are 3 people who are South Africans who have been diagnosed as such. 2 were diagnosed in the Diamond Princess cruise liner outside the coast of Yokohama in Japan, and then one has been diagnosed today. We've been informed of one person who is in South Korea. He is a South African citizen, about 39 years old male, who is a teacher, was working in the town of city of Daegu. So those are the ones that we've got, but the three are outside South Africa. We're monitoring what's happening to them. Inside the country, there are only two.
So, Minister, what is now concerning, of course, for those in South Africa is the second case. The woman who was part of the trip that was undertook by the first case, she was also traveling alongside 8 others. They are under quarantine, is that correct?
Yes, it is true. They are under quarantine and they were not discovered by mistake. We found the one contact who presented yesterday and we confirmed that he was positive in Pietermaritzburg. And then he indicated to us that there were 10 of them who traveled together into Italy and back, and some of them are not back into the country. So we then took all of those as immediate contacts that must be tested and be put on voluntary home quarantine. That has already happened, and those were tested. The others were still waiting for the results. So as soon as each one of those results come out, we'll actually publicize we'll announce to the public. So this particular one is in Johannesburg and is already getting in for treatment, getting admitted for treatment in Charlotte Maxeke Hospital. So the others were waiting for the results, but they're safe because they are on voluntary quarantine at their homes.
But Minister, I mean, the number of people who could have come in contact with these 10 could be exponential, because I'm sure you don't have exact figures as to how many people they all were in contact with.
Well, I think let's put it this way. There's a scientific way of tracing all the contacts. We follow that approach and then we discover people as we find people getting to test positive. So in this case, we found one person. We then went around to check who else was with him. We've got a number of people that had to be checked. So we've gone through all of those people. So if they remember anyone who has been in close contact with them, has either spent a long time with them, or has been very close to them who could have been infected, we want them to disclose all of those names. By yesterday, we had a list of no less than 18 people that had to be followed up. So we are going to continue to find all of those who are affected. Then those who are in the flight, everyone who goes into the flight will be recorded as having been part of that flight. We know their seat numbers, so we immediately go for those who might have been in the close proximity to each one of the patients that we have, and then we're going to trace them as well and talk to them wherever they are. Already, when people are coming from some of the areas that have got a high infection rate, we actually check them and look at their seats and warn those who are around them that we need to know where their whereabouts so that we can call them and also always check on their health and see whether they're developing symptoms. So we surveil them over a period.
Is there enough information about the behavioral patterns of the virus? And I'm thinking here of a case of that woman in Sichuan who was tested 8 times before they discovered that she is positive. So, and without causing alarm, I think South Africans are wondering just how much time do you have to spend with someone? When you say in close contact and spend a long time, is it possible that I could have unwittingly been with any of these people in a public place and I would have been exposed to it?
Well, I think firstly we need to use more the information that we know for a fact and not try and look for the most obscure possibility, and because that's what causes people to be anxious and panic. The basic things are that most of the people who are infected with any viral infection, they become asymptomatic for a period when the virus is incubating in the body, which means that the virus has not exhibited any sign of illness in the individual and is unlikely to spread to the next person. As soon as they start showing symptoms, that's when the cough and the sneeze would start spreading the infection to the next person, and that by that time, when you test the individual, you will find that they are now positive. So we then will find that many people who might be tested and are showing no sign, it means the virus may not yet have exhibited changes in the body that would either show give the patient the symptoms or show us the results in a test. So that way we are assumed that those people are likely to be safe, and then only when they've got symptoms and they are positive, then they will be effective. Then if they've been treated and no longer have symptoms and recover from the virus and the test is negative, we also assume that they will not be effective at that point.
All right, final question, Minister. I want to talk about the quarantine accommodation. We spoke to your Acting Director General, Dr. Anban Pillay, just the other day, who was saying that there are concerns around available places to put up those who will be quarantined because people are, quite frankly, nervous themselves.
Well, I think let's just deal with the issue from the human side of it. I don't believe there's a South African who can sit and say we don't want to help any South African who is needing assistance anywhere in the world. Now, the problem that we face is that sometimes people send wrong information to the public and create a scare and panic on people even before they've got correct information. Sometimes the media does this, sometimes individuals who are part of the government staff do this, and that becomes very unfortunate because people then react on the information they have, even if the information is incorrect. Right now, we have actually sent our health team as well as the military to view 84 sites throughout the whole country. And as we go along, we ask the owners of the facility to give us certain information and certain documentation. And as we go along and negotiate and discuss and assess, then people pick up that we've been in this area and that area. Then those who misinform the public then start creating stories that make people feel that they must be concerned. We just want to assure everyone that we are going to continue to evaluate the suitability of various areas, and when we have concluded with the owners of those facilities, we'll announce it. But we'd like people to calm down and not panic because any of the people who are coming from China are not infected, and we will be very strict in looking after them and making sure that they are well and that no one is infected as a result.
Minister, is there a date for those
coronavirus coming from other parts of the world, not necessarily from those who are coming from China?
Is there a date for when those who are going to be repatriated are going to be back in the country?
The date we had said we're given 7 to 10 days. We're still within that time. And if we need to change that, we will announce. But right now, everything is on course. We really believe that it will be done within that time.
All right. Thank you very much, Health Minister Dr. Zwelithini Mkhize. And here you are. On your screen is the hotline number for coronavirus, that if you need information or perhaps you may have suspicions of either yourself or someone around you who may need to be tested, use that.